Do you know that creatinine levels are usually higher in men than women? That's mainly because men usually have more muscle mass than women. Creatinine is the byproduct of muscle breakdown. So, the more the muscles, the more production of creatinine. High creatinine levels can also be caused by dehydration, kidney disease, and sometimes even due to overdosage of dietary supplements. People with healthy kidneys are least likely to develop high creatinine levels, and even if they do for some reason, healthy kidneys can do well to flush that extra creatinine out of the body. But as the kidney function declines, their ability to flush that creatinine out of the body reduces. It's important to note that kidney disease, particularly in its early stages, is often silent, so you might not even know you have kidney disease until it gets much worse and shows up in the form of excruciating noticeable symptoms. So even in the early stages of kidney disease, you might still have high creatinine levels and probably wouldn't know about it. So we need to take care of our kidneys so that they can do their job of keeping creatinine levels in check. So how can you do that? Here are some of the best herbs and spices that can help lower creatinine levels naturally and improve your overall kidney health. Number 1. Cinnamon. A spice derived from a green bushy tree, cinnamon has been used for various health problems due to its anti-inflammatory and antioxidant properties. Cinnamaldehyde, cinnamate, cinnamic acid, and different essential oils in cinnamon can help treat kidney disease and its several risk factors, such as high blood pressure and high blood sugar. Not only that, cinnamon has also been shown to help lower creatinine levels. The diuretic properties of cinnamon trigger urine production by the kidneys. This, in turn, helps remove excess creatinine from the blood, helping to maintain its levels. Cinnamon is also a good source of fiber. This fiber content is not just useful against digestive problems, but also for kidney health. Fiber helps improve gut health and enhances the production of short-chain fatty acids, SCFAs, that can help improve kidney health due to their anti-inflammatory properties. Around half to 1 teaspoon of cinnamon is considered safe to consume. Taking too much of it can increase the risk of liver damage due to its coumarin content. Coumarin also acts like a blood thinner, and its potency is comparable to that of popular blood thinners, like warfarin. So be careful if you're already taking blood thinners. Two of the most common types of cinnamon are Ceylon and Cassia, but Ceylon cinnamon is usually recommended for its lower coumarin content than Cassia cinnamon. Number 2. Ginger. Ginger can help enhance kidney function primarily due to polyphenols and flavonoids in it. These compounds can help reduce urea, creatinine, and uric acid levels in the body. In a 2019 study, participants were given 100 to 200 grams of ginger extract. The results showed improved overall kidney function and a decrease in urea and creatinine levels. Gingerol, a phenolic compound present in the ginger root, helps in digestion and the movement of food throughout the digestive system. CKD patients might suffer from symptoms like nausea, vomiting, and epigastric pain. Ginger can help relieve these symptoms too. Ginger is also a natural calcium channel blocker and ACE inhibitor. Medications with these properties are commonly used to lower blood pressure, so ginger can also help keep the blood pressure in a healthy range. Ginger can also help manage blood sugar levels, lower inflammation, relieve pain, and improve immune functions. Remember that if you're taking medications for blood pressure regulation or blood sugar regulation, talk to your doctor before making ginger a regular part of your diet. Pregnant or breastfeeding women should not take more than 1 gram of ginger to avoid complications. The safe amount of ginger is 3 to 4 grams per day. Taking more than that can cause side effects like heartburn, stomach discomfort, and sometimes even diarrhea. You can use ginger in various dishes in the form of ginger paste or dry ginger powder. You can also make ginger tea by adding 2 tablespoons of sliced ginger into 4 cups of water and boiling it for 10 minutes. Then add lemon or honey to enhance its taste. Number 3. Garlic. While garlic is commonly used as a spice, it is a root vegetable. It offers many health benefits due to the presence of bioactive compounds like allicin and minerals such as potassium, phosphorus, zinc, and magnesium. However, garlic might not be able to lower creatinine levels directly from the blood. It does help improve various other aspects of kidney health, especially the risk factors. One of those risk factors is high blood pressure. Garlic can help keep the blood pressure in a healthy range. In fact, according to a study, eating garlic regularly can systolic blood pressure by 7 to 9 units and diastolic blood pressure by 4 to 6 units, which is promising. Garlic's antioxidant and anti-inflammatory properties can protect arteries from damage and improve the flexibility of blood vessel walls, while its cholesterol-lowering properties can help clean the arteries from plaque. Another major risk factor for kidney disease is uncontrolled diabetes, especially in the case when blood sugar levels stay consistently high. Regular garlic consumption has been shown to improve insulin sensitivity, meaning it can enhance the ability of your cells to utilize blood sugar, and hence, potentially better control over blood sugar. So, by addressing these risk factors, garlic might be very effective in improving the kidney's ability to flush out toxins and waste products, including creatinine. Usually, eating 1 to 2 cloves or 3 to 6 grams of garlic is considered safe to consume. Taking too much of it might cause side effects, like heartburn and flatulence, and may even worsen stomach ulcers for those who already have them. Plus, if you're already on medications, especially blood thinners, antibiotics, and the ones for controlling blood pressure, cholesterol, and birth control pills, talk to your doctor about possible interactions. Number 4. Oregano. Oregano is an antioxidant-rich herb that offers various health benefits. It has been traditionally used for wound healing, parasitic infections, relieving cough, and improving digestion. For specifically kidney function, a 2024 study showed that oregano extracts might even be effective in recovering from CKD and bringing a better quality of life for CKD patients. Plus, like garlic, it has been proven to lower creatinine levels directly, but studies show that it can improve overall kidney function with its antioxidant, anti-inflammatory, blood pressure regulating, and blood sugar regulating effects. Oregano leaves are likely to be safe when taken in amounts typically used in foods. Regarding oregano essential oil, even dosages of 200 milligrams of oregano oil 3 times a day have been used in some studies. But it's best to stick to a few drops of oregano essential oil to avoid potential side effects or drug interactions. Number 5. Basil. Basil is often used in traditional medicine for treating stomach cramps, loss of appetite, gas, fluid retention, head colds, and worm infections. A 2019 study, though conducted on mice, showed that basil can help improve GFR, glomerular filtration rate, and lower serum creatinine levels. The same study also demonstrated basil's potential against diabetic nephropathy, which is kidney damage due to high blood sugar. Not only that, basil has also been shown to help lower high blood pressure and high cholesterol levels. Plus, it contains magnesium, which has a relaxing effect on the muscles and arteries, allowing for smoother blood flow and more balanced blood pressure readings. Generally, using culinary amounts of basil leaves, which is up to 6 to 10 leaves, is considered safe. As for holy basil extract, it has been used safely at a daily dose of 500 milligrams for up to 60 to 90 days. But if you're considering basil extract or oil, be sure to talk to your healthcare expert about the recommended amount based on your health condition and to ensure that it doesn't interfere with your treatment or any medications you might be taking. Number 6. Turmeric. Turmeric contains a group of compounds called curcuminoids. One of them is curcumin. Curcumin is well known for its powerful antioxidant and anti-inflammatory properties. In fact, according to a 2021 study, curcumin or turmeric supplementation has protective effects on the kidneys, particularly against oxidative stress and inflammation, which are often the root cause of kidney damage. Besides that, turmeric has also been shown to help relax blood vessels and clean the arteries from plaque, helping to keep blood pressure in a healthy range, which is crucial particularly for CKD patients. But there's one important thing to consider. Turmeric is also high in oxalates. So if you have a history of kidney stones or have a high risk of developing them, avoid taking turmeric. That said, taking up to 3 grams or a teaspoon of turmeric daily is considered to be safe for most adults when used for up to 3 months. It also seems like a good idea if you take turmeric with black pepper, as piperine and black pepper combined with curcumin increases its absorption and therefore its potency. You can also take organic turmeric capsules with black pepper that are easily available over the counter. Number 7. Parsley. Parsley is another great and common spice that can help lower creatinine levels naturally. It is particularly rich in vitamin C, which itself is a powerful antioxidant and even has anti-aging effects. This anti-aging effect applies to the skin and helps improve eye health, enhances immune function, and reduces oxidative stress in the body. You might be surprised to know that despite being high in oxalates, parsley has been shown to reduce the risk of kidney stones. That's right. A 2017 study analyzed this effect and showed that parsley tends to trigger urine production, increases the excretion of calcium in the urine, and makes the urine more acidic. This, in turn, can significantly reduce the chances of calcium oxalate crystal formation in the kidneys. Not only that, with its diuretic effect and healing properties, parsley might also enhance the ability of kidneys to flush out wastes and toxins, including urea and creatinine. 1 to 2 tablespoons of crushed parsley is generally considered to be safe to consume. You can add parsley to your soups or salads, or sprinkle it on different dishes. You can also make parsley tea by soaking it in boiling water for 10 minutes. Taking parsley tea up to 3 times a day might even help treat kidney stones, urinary tract infections, hypertension, and fluid retention. But it's best to start with smaller amounts and 1 cup per day and talk to your doctor before making it a regular part of your routine. Number 8. Fennel seeds. Fennel seeds have a natural diuretic effect, triggering the kidneys to produce more urine and removing wastes and toxins with it. Plus, they have been shown to have significant antioxidative effects, which also extend to kidneys, according to a 2023 study. In short, eating fennel seeds regularly can help protect the kidneys from damage and might even improve their ability to lower creatinine levels naturally. You can safely consume around 1/4 to 1/2 tablespoon twice a day. It also helps in digestion and may also help you lose weight. For a cup of fennel tea, boil 1½ cups of water. Then add 1/2 tablespoon of crushed fennel seeds in it with 1/4 inch of lightly crushed ginger. Boil it further for about 5 minutes. Then remove the pot from the heat and let it simmer for a while. Then strain it into a cup, add 1/2 teaspoon of honey, and enjoy your cup of fennel tea. Number 9. Coriander. Coriander helps lower blood sugar levels, boost the immune system, and improve heart health, digestion, and kidney functions. For specifically kidney health, coriander can be effective in a few ways. First, coriander is a natural detoxifier and blood cleanser. Certain compounds present in it help the liver detoxify chemicals and toxins, and its diuretic effects trigger the kidneys to flush those toxins out of the body. Coriander has also been shown to prevent stone formation and urinary tract infections, and might even help lower urea and creatinine levels naturally. Another good thing about coriander is that it can address both high blood pressure and high blood sugar, which are often the culprits behind chronic kidney disease. You can consume coriander in many ways. You can eat its leaves and seeds, and even take coriander extracts as supplements. The best thing to do with coriander is to make coriander juice. Put the coriander leaves, lemon juice, ginger, 1½ cups of water, and cucumber if you have it, into a blender. Blend it for 1 to 2 minutes, then strain through a fine mesh and enjoy with some ice. You can drink a glass of coriander juice daily. Number 10. Rosemary. Rosemary is particularly renowned for its ability to inhibit an enzyme called urease. This enzyme is often responsible for uric acid crystals. Rosemary has also been shown to help regulate blood pressure and prevent diabetic nephropathy, a leading cause of CKD in diabetics. About 1 to 2 grams of rosemary leaves are considered safe to consume. As a tea, if you're healthy, you can drink up to 3 cups of rosemary tea per day. Rosemary extracts, essential oils, and supplements are also widely available, but be sure to read product labels and follow the manufacturer's dosage instructions. And if you've kidney disease or other risk factors of kidney disease, remember that rosemary has also been shown to interact with certain medications, such as blood thinners, NSAIDs, pain-relieving medications, and some others. Talk to your healthcare expert about the appropriate amount suitable to your needs and individual health condition. You can also manage your creatinine levels by simply following these important tips. Number 1. Avoid supplements that contain creatine. When there is a lot of creatine in the muscles, it might break down into creatinine, which causes an increase in creatinine levels. Number 2. Reduce high-protein foods such as red meat. Number 3. Eat more fiber as fiber helps in the removal of creatinine from the body. Number 4. Drink more water and consult your healthcare professional about how much fluid you should drink. Number 5. Reduce your salt intake, as salt can hold onto water and cause water retention. This makes it difficult for kidneys to remove creatinine. Number 6. Lower the consumption of NSAIDs. These medications can increase the risk of a kidney injury, blood pressure, and CKD. Number 7. Reduce smoking, as it can cause oxidative stress and inflammation that could result in reduced kidney function. Number 8. Reduce your alcohol intake. It can cause dehydration and direct kidney damage, resulting in high creatinine levels. To know more about how you can lower urea and creatinine levels and improve your overall kidney health, watch these videos on our channel.